28th day of uninterrupted daily webinar of International Forum for Promoting Homeopathy. Before beginning the session, let's have a silent prayer. Fellow doctors, students of homeopathy and friends of homeopathy. Today, the 1128th day of uninterrupted daily webinar of International Forum for Promoting Homeopathy. The English session is starting. And today's our guest is Dr. Vaidehi Kumari Gupta, MD Homeopath, Assistant Professor, Department of Practice of Medicine, Dr. R.B. Singh, Gaya Homeopathic Medical College and Hospital, both Gaya, Bihar. And today, a very exciting, very interesting subject is secrets of periodic table in homeopathy. You all will be very familiar with classification of medicines in homeopathy, but the secrets of periodic table in homeopathy is really a thing to ponder on. So let's welcome Dr. Vaidehi Kumari Gupta for the session. I welcome all for the session.
Good evening to all. Thank you, sir. Thank you for such a warm welcome, and thank you IFPH for giving me opportunity on such a huge platform.
Doctor, you can unmute.
Unmute yourself, Dr. Vaidehi.
Good evening to all. Thank you, sir, for such a warm welcome, and thank you IFPH for giving me an opportunity on such a huge platform. I'm just sharing my screen. Is it visible?
Yeah, visible.
Yes.
Okay.
Yes.
So the topic is secrets of periodic table in homeopathy.
But you need to select a file.
You have not yet selected.
Okay.
Yeah, you have to select your PPT.
Now is it visible?
No, your PPT is not uploaded.
Okay.
Not yet uploaded. The screen is visible, but your PPT is not visible. Yeah, it is on this lower side. Just you see, on the lower side it is there. This side. Come down. Then again down.
So now is it visible?
No, not yet.
Still not.
You have not yet opened. This one.
Okay, resume share.
You have to click your PPT. Then only it will be uploaded.
I don't know what is happening.
You close the sharing and then again start.
Now?
So your PPT is not coming, na? Your PPT is not coming.
Isn't it in a PDF form?
No, it is not visible. It is not open. You have not clicking your PPT. You have to click your PPT. You have not clicked your PPT, and you are on the. It is not on a desktop. Why don't you put this PPT on the desktop, and then you will be able to.
Okay.
Last time you have did well.
Yes, sir. I don't know what is going on.
start sharing again. You put it on the desktop and then you start sharing. Then it will come very easy. Now it is.
Yeah, perfect.
Okay.
Okay, it is there.
So the topic is secrets of periodic table in homeopathy.
It is visible now.
Introduction. Approximation of the clinical picture of a remedy is based on its physical and chemical behavior. So the physical property of an element, the chemical property of the element is the physico-chemical language of the element, which is reflected as clinical language of the medicine. There are 7 rows in a periodic table. They are horizontal rows. They are also called series, and there are total 18 groups which are also called columns. 7 series or rows corresponds to 7 themes. So there are 7 themes in the periodic table as per the rows, and there are 18 columns that corresponds to 18 stages. So there are 18 stages as per the columns. The point where the column and the row intersect, it is the element. So that particular element have both the properties. They have the property of the column, that the stage, and also they have the property of the row, means that the theme. Rows. There are 7 rows and every row is about a certain theme. Row 1 is conception and existence. Since the elements in the row 1 are quite small, hydrogen and helium. Hydrogen has atomic number 1 and helium has atomic number 2. So both of them are quite small. That's why there is a doubt whether they actually exist or not. And also all these 7 rows correspond to a certain age group. So it relates to the age of born or not. Row 2 is about fetal life and the birth process. It is a phase when a fetus is in the mother's womb in the intrauterine life, and as going from left to the right in the periodic table, the fetus is getting separated from the mother, and at the end he will come into outside world. So this is a phase of fetal life and birth process. So it reflects the age as of infant. After getting birth, that infant want nourishment. He also want identity. He starts identifying things. So it is a phase of child and toddler. Then after getting nourished, after getting some identity, he also want security in his life. It may be financial security, it may be protective security. So security and task belong to the teenage phase. In teenage phase, we just want to be a astronaut, we want to be millennial. So all these phases are in this teenage phase. In row 5, it is a row of creativity and performance. So in adult life, after that security, after getting a job, we just want to perform better so that we can get a better designation. So it is a phase of creativity and performance. Row 6, after getting the that position, there are lots of responsibility because it reflects to a middle age. So there is this, being a man, there is a responsibility of his wife, there is a responsibility of his children, there is a responsibility of his old parents. So it is a row of responsibility. In row 7, it is a phase of letting go. It reflects the old age. So it reflects disintegration, it reflects old age. So basically all these 7 rows are from birth to the old age or the death. When I say that this particular row is related to that particular age group, it doesn't mean that an infant can't get a medicine of row 6 or an adult can't get a medicine of row 2. Of course they can. It is like it is the mental age that will define to which group they depend. Like when we talk about Bayata carb, Bayata is a barium and it is in row 2, but we give Bayata to old people. So because they behave like childish. That's why when we say about the age group, it is about what is their mental age. Columns. There are 18 columns, and while from going left to the right, there is gradual changes. Like in example, it is row 2, lithium and neon. Lithium has atomic number 3. Its electronic configuration is 1:2s1, while neon has electronic configuration of 1:2s2 2p6. Its atomic number is 10. So the outer shell of lithium has just 1 electron because it belongs to column 1, and neon has 8 electron in the outer column because it belongs to column 18. So lithium needs 7 more electron to complete the octet, while neon doesn't want any sort of electron. They have already 8 electron. That's why lithium is dependent, neon are independent. Lithium, there is a feeling of lacking in the lithium, but there is no such feeling in neon. They are content, they are satisfied. Valency. While valency is the number of electron an element lose or gain to complete the octet, that's why in column 1 there is +1, then +2, it gradually increases, and in transition element, that is the D block, it belongs between S block and P block, so they have variable transition element, variable valency. While going more the right in column 13, it's +3, then suddenly it will decrease, -4, +4, -3, -2, -1 and 0. Column 18 has 0. They do not form ion, that's why they are inert gas. They don't react that much, they are quite content, satisfied. Helium, neon, argon, krypton, xenon, radon. Xenon used to react with fluorine or chlorine, but they are very less amount. So overall we can say that 18 group is inert gas. They don't want to react to anyone. They are in their own shell. They are quite content. While seeing about the valency, there are 3 kids. The kid in maroon t-shirt is ascending, so the valency is gradually increasing. The number of electrons is increasing. So there is a hope. They want to get the success in their life. So it is a sign of hope. The girl who is on top, it reflects column 10, because in column 10 there is success. They want success in their life, so it is a phase of success, and suddenly there is a decline. The number of the valency decreases. They can't hold that success anymore, so the phase usually decreases. So the peak is on 10, and at 18 they are content. Column. Remedies in the columns, the first column, remedies in the column on the extreme left, that is the first column, feels themselves incapable of success. They are quite dependent on others because of having just 1 electron in the outer shell. That's why they are very dependent on other to get the success. That's why they think that they are incapable of getting success all alone. Column 2 to 9, from the left to the middle, they are trying for success. Since they want success, they want to prepare. They want to prepare themselves, they want to train themselves, they want to prove themselves, they want to struggle, they want to fight with the situation so that they can get success. In column 10, they are successful, they are a ruler, there is a superiority complex in column 10. Column 11, they are maintaining success. After getting the success, they just want to maintain that thing. Like when a student got A+, he stood first in the classroom, he want to get that top rank again in the next exam. So it is a phase of maintaining the success. From column 12 to 18, towards the extreme right, they are failing and giving up the success. And while dealing the columns one by one, column 1 is beginning because they are quite dependent on others, so it's just the beginning of their life. Column 2, they need support, although they are not that much dependent as 1, but they are quite dependent as a backup plan. Like, okay, I am alone, okay, but when I need something, I need a backup plan. Column 3 is doubt their capacity. They don't know whether they can do that thing or not, whether they can get the success or not. So there is a phase where they doubt their capacity. In column 4, they establish, they know that yes, they want success. Column 5, they used to prepare themselves to get that success. Column 6, they want to prove themselves that yes, they can get the success. Column 7, they train more and more. Column 8, they want to fight, they want that struggle. Column 9 is near perfection, because column 10 is perfection, the phase of success. So column 9 is near perfection. That's why there is lots and lots of anxiety in column 9. What if they will fail? What if they will lose? So there is great anxiety in column 9. Column 10, it is a phase of perfection, it is a phase of success. Column 11, they want to maintain that success. Column 12, they want to defend that success. That when there is an employee, he doesn't want that his colleague will get his post, or other student will get his rank. So he want to defend themselves. Column 13 is about confusion. They know that they can't take that success anymore, they can't hold that success anymore, so there's a confusion that whether they should leave that thing or continue with it. Column 14 is a give up situation. They give up and they accept the changes. Column 15 is a column of loss, so they feel the sensation of loss. Column 16 is the memory. The success is gone. The only thing that is left is the golden memories, golden cherished memories of those success phases. Column 17 is nearly complete because there is only one electron needed to complete the octet. So they are nearly complete, but they are not complete yet. While column 18 is complete. There are some similarity in such groups like like column 1, column 2, column 3. Column 1 is totally dependent on someone, on mother or on mother-like structure. When I say mother-like structure, it's like to whom on which we are dependent. Like for a child, he is dependent on his mother, on his father. So basically he is dependent on his parents. A husband is totally dependent on his wife for the household chores. A wife is totally dependent on his husband for the financial things. An old lady is totally dependent on his son for food, for shelter. So it can't be anyone, the spouse, and just like that in column 2 they need guidance. They are not totally dependent, but they need guidance. They need a backup plan. Like yes, I can live in my home, but when I feel any sort of danger, I just want to come there with that mother-like structure. Column 3, they are little independent but still want care and affection. Column 9, column 10. Column 9 is near perfection. Column 10 has perfection. So because column 9 is about to get that success, they are very anxious. There is fear. What if they will lose? What if they can't get that success? Because there is lots of responsibility on him. They had worked hard for that success. So there are lots and lots of anxiety. While column 10 have perfection, they are success. They feel like a ruler. Just like that, column 17, column 18. Column 17 is nearly complete. Column 18 is complete because column 17 fluorine, column 18 neon. Fluorine has electronic configuration 1s2, 2s2, 2p5. So 7 electrons are in outer shell of fluorine, while in neon the electronic configuration is 1s2, 2s2, 2p6. So there are 8 electrons. They are content. Fluorine needs just 1 electron to complete that octet. That's why they are nearly complete. That's why we are very much desperate to get that octet. Rows. I'll explain 7 rows and as well as I'll also explain the columns. Row 1. There is a feeling, do I exist or not? Because they are very small, hydrogen and helium. So there is a strong feeling of being unnoticed because there are lots of other elements who have more atomic number, more atomic weight. So they feel quite small, they feel unnoticed. They are very less in atomic number, so there is no ego. They are very naive, simple. Hydrogen, helium. Some lines are mentioned in the yellow fonts. They are just for the sake of reference to which column they belong and which row they belong and what is the keyword of those rows and columns. So like row 1 is about existence. So both the elements have that phase of existence. While hydrogen is column 1 and they are totally dependent, and column 18 helium are content. They don't need anyone. They are independent. Hydrogen has no electron, just no neutron, just one electron and one proton. That's why they are hyperactive. They used to make bonds with various elements. So they are hyperactive. They just want stability. They just want that single electron to be stable, to get the electronic configuration of 1s2. While helium, they are content. They feels happy in the womb and doesn't want to exist in the world outside. They are quite happy in the mother's womb. They don't want to get outside the world. There are some rubrics of complete repertory. Delusion, imagination, smaller. There is a delusion that they are quite small. So they feel like I am nothing, I am small because atomic number is very less. So they feel that they are nothing. Is there any value of mine? Is there any value of mine in the family, in my friends, among my colleagues, among my neighbors? So they feel they are not that much important to other people. Another rubric is, and in this in this symptom, hydrogen is mentioned. It is a proved medicine. Just like that, delusions, imagination diminished. Here is also hydrogen. He think that no one even notices me. I am that much small that no one is notices me. He feel like diminished. There are two medicine who think that they are small, but there is a difference. Hydrogen and beta carb. Hydrogen has, I am small, people can't see I am there, even I am existing or not, no one looks at me. This is a feeling of hydrogen, that people are not noticing me. While beta carb has, I am small and people are laughing at me, they are mocking at me. That is beta carb. Column 1, hydrogen, lithium, sodium, potassium, rubidium, cesium. There is dependence in the entire column, but the level of dependence is different. Like hydrogen, it is a row of existence, so they are dependent for existence. They are dependent on that mother-like structure for the existence. Lithium, they are dependent for survival, because they want nutrition from the mother, so they are dependent for the survival. Sodium, they are dependent for identity. Like if there is a medical student whose father is also a doctor, he will sit with his father in the clinic because he is totally dependent on his father. Like he will see the patient, he will just sit along, or his father will guide him all the time. This is the feeling of sodium. Potassium, there is a dependency for security. Like a wife is totally dependent on his husband for the financial security. That is potassium. Rubidium, dependent for creativity. Like if there is a boss who is totally dependent on a certain employee, like yes, if he will be present in the presentation, then the presentation will be fine, otherwise not. So what if he will be absent on that day? What will happen when he will be transferred to some other state? So he totally dependent on that fellow for the creativity. Cesium, dependent for responsibility. Because it is the first group, they are not that much confident, they are dependent on others, so they are also dependent for the responsibility on others. They can't take responsibility of him, of his house, of his family. Row 2, it is a row of attached. There is a strong feeling of attachment. With somebody's help I can do something, but all my alone I can't. He just want a backup plan. If it is like a temporary tent, like that person on which he will depend will be like a temporary tent, he just need a backup. There is a feeling of a strong clinging. So like the fetus will cling with the mother or anyone who is around him. And also there is a fear of separation, because he is very attached to that person, that mother like structure. So there is a great fear of separation. He don't want to be separated from that mother like structure. Row 1 is totally dependent, row 2 is attached. Row 2, lithium, beryllium, boron, carbon, nitrogen, oxygen, fluorine, neon. Lithium, he is totally dependent. Since the row is about attachment, so the entire row has the that feeling of attachment, but at different column the symptom will change. Lithium, they are totally dependent on the mother like structure. He is totally dependent, attached to his mother. Beryllium, with someone I can do, but on my own I cannot. Beryllium need a backup, like with someone I can do something, otherwise I can't do it. Boron, fear of separation, clinging to mother. Boron, borax, the child used to hold his mother firmly, because there is a fear of separation. It's like when he is separating from the mother, there is a fear what will happen when he will separate from his mother. They don't even want to get separated, they don't even want the thought of the separation. So that's why there is fear of separation, clinging to mother. Carbon, how will I manage, how will I do it my own? If I will be separated from that mother, from the mother or mother like a structure, how will I manage? He is just thinking about it. Sodium, feels trapped and wants to be separated. Now it is the time when he is at the verge of separation. He just want to get separated. He is feeling suffocated. That's why he feels like trapped and he want to be separated. Oxygen, already in the outside world and want to breathe. Oxygen is of course for the breathing, for respiration. So he is in the outside world and now he want to breathe. He want to do something in his life. Fluorine, want to be independent. Fluorine just need one electron to complete the octet. That's why fluorine has a strong feeling of being independent. He just want to be independent at any cost. Neon, they are content, they are satisfied because they are of column 18. Now column 2. Beryllium, they just need a backup in the entire row. but there will be certain difference. Like beryllium want they just need support. Beryllium want if someone I can do, but on my own I cannot. So he wants like there must be someone with whom I can do something, otherwise all alone I can't. Magnesium, if I tell my choice, I'll be left alone, introvert. Like if 5 friends are going to a restaurant and 4 of his friends are ordering some kind of food, and but Magnesium want to order something else, but he will order the same food like his friends, because he don't want to be left out. There is a slang FOMO, fear of missing out, which is quite prominent in Magnesium. There is a fear of forsaken, like if I want to do things according to them, they will leave me, my friends will leave me, my parents will throw me out if I won't live like him, if I want according to them, if I want to get that much marks, then they will scold him, they will throw him out. That's why there is also a feeling of orphanage. So there is an orphanage feeling in Magnesium. They just want care. That's why they want to do things according to them. They are introvert. Its atomic number is 12, atomic number 11 is sodium. They are also introvert, but Magnesium is expressive, but they don't want to express. That's why they are introvert. Although they can express themselves, because there is fear of forsaken, they want to express. That's why they are also introvert. Calcium, I am secure in a normal condition, but if there is a threat, I need support, backup. Like a child who is sleeping in separate room and his parents is sleeping in other room, he can sleep all alone, but when there is thunder, when there is raining outside, when there is lightning, so he will be go back to his parents room. He can't sleep alone because there is a feeling of threat, because row 4 is the row of security. He wants backup in the security. That's why he is running to his mother. Strontium needs guidance to learn the creativity. It is a row of creativity, so he wants guidance to learn the creativity. Barium, I can take responsibility because it is the row of responsibility. I can take responsibility, but when too much responsibility for me, I need depend upon someone. He can take responsibility on a normal condition, but when there will be lots and lots of responsibility, he can't hold it anymore. So it is they need a backup plan so that he can be dependent on others. Boron has fear of separation. That separation, it can be of any kind. That's why boron means borax has a fear of height. They are quite fearful on that hiding place. There is a fear of falling from high place. There is fear of crossing the bridge because all of them have separation. There is a fear of descending. There is a vertigo on looking down. Even boron have dreams of falling. There is a rubric, clinging children of, awake terrified, no one, scream, cling to those near. इसमें बोरिक, here it's borax. So the child, when they get up, they are terrified and they just want to cling anyone who is near them. It can be his mother, it can be his relative or anyone. Even he don't know who is near him, he will just cling him. Attached very mother too. So there is a great attachment of boron to his mother. He cannot imagine life without mother or mother-like structure. He is very attached to his mother. Column 13, it is the column of confusion. Boron, aluminium, gallium. Confusion is in the entire column, but the level of confusion will be different. Like in boron, there is a confusion about separation. Do I need to hold mother strongly or I have to be on my own, because it is a row of attachment. So he is confused whether I should hold my mother or I have to go out in the outside world. So there is a confusion. Aluminium, confusion about identity, choice. Shall I do or shall I depend? There is a confusion about identity, whether he should be a doctor or an engineer or an astronaut, or whether he want this, he want that. He is totally confused about the identity of his choice. He don't know whether he should depend on other for such things or not. Gallium, confusion about security. He is quite confused about the security, whether they want that financial security or not, whether he want to be independent or he should depend on other. This is the confusion of security. Column 14, carbon. How will I manage? How will I do it my own? There is a strong feeling in carbon. Medicines are carbovase, carboanimalis, petroleum, creosote, carbolic acid, diamond, graphitis. All of them have such feeling. like okay, when I will get separated from that mother like a structure, how will I manage, how can I do things on my own. Carbon, column 14, carbon, silicon, germanium. Carbon, how will I manage or tackle the situation? There is a feeling of carbon. Silicon, concerned about image, what other people thinks, because it is raw of identity. So very much concerned about his image, what people will think about him. I need to be someone special, then I will get affection. I want to get first rank in my exam, so that people will notice me. I should get earn lots of money, so my family will notice me. So he want image, it's all about his image. There's a fixed idea that he have to excel in his life to get the success. That's why there is a fixed ego. That's why Silesia has a fixed ego, fixed ideas. Germanium, it is a row of security. Germanium, anxiety about family, health, children. So they are quite concerned about the security. Like when there is a cancer patient who is on chemo, who is taking medicines, how long would I survive? He will ask the doctor. Okay, I have cancer, but now what? How long will I survive? There is a sign of hope that okay, it's okay. I am a sufferer of cancer, but I accept that change. Now what? This is a feeling in germanium. Just like that, when a woman thinks that her husband don't love her, but he don't want divorce, because although her husband doesn't love her, but at least her children has a father. That's why she don't want divorce. Column 15, it is a column of loss. Nitrogen, phosphorus, arsenic. Nitrogen, a strong trapped feeling. Nitrogen is in gaseous form naturally, but while making medicine, it is stored in liquid form. So that liquid want to get converted into gas. There is a strong feeling of escaping out. That's why there is a strong feeling of suffocation. They feels like trapped. That's why there is claustrophobia, fear of being in closed spaces, and they just want to be in open space. They think that their parents are very dominating. They think that they can't do anything by his own. His parents will decide what he will do, what he will not, and he want to be free from that phase. Phosphorus, they have clear cut choice. My parents doesn't understand me. My friends too. He stands from family, but he can make friends easily. In the outside world, they are quite popular. They want to impress people. Let's gets lots of affection from the outside people. What parents are giving opposes. So there is own choice ego. Like when parents will say that you should be a doctor, he will say no, I will be anything, but I won't be a doctor. So he will just oppose such thing. That's why there is own choice ego. I'll do things of my own choice. Arsenic, they want to depend, but there is no one, because it is a column of loss. So there is a feeling of loss. They want to depend on someone, but they can't be dependent. Same thing is in column 2. They also want to be dependent on someone as a backup plan, but they know that there is someone. But in arsenic, they feel the sensation of loss, that there is no one on whom they can depend. Column 16, oxygen. Oxygen is like a fish outside a bowl. They will just move rapidly. They just want to gasp for air. Earlier it was in a mother's womb, now they are in outside world. So it is like a fish in water. Earlier it was in a fish in water, now they are in fish outside the water in air. Earlier it was a comfort zone in the mother's womb, now they are in uncomfortable situation. He have to do things on his own. Earlier he was in mother's womb, now he is in outside world. And also there is gasping for air. Oxygen is the medicine for that gasping of air. That's why in oxygen medicine there is a symptom for the asthma. Column 16, oxygen, sulfur, selenium. Oxygen, there is a desperate situation because he is in outside world. So there is a desperate situation, want to breathe, come out, already in the outside world and just want to breathe. Sulfur, I know better than you, foolish ego, and talk foolishly. There is ego in phosphorus also. Phosphorus, atomic number 15, there is also ego, because phosphorus constitution is different. Like in a crowd of 10 people, everyone can notice phosphorus because she looks different. She is quite beautiful than others, that's why they are different. So they are different, that's why they think that they are different. Sulfur has the ego like I am better than you. This is a foolish ego, they talk foolishly. Selenium, impotent, functionless. A structure has lost its utility completely. There's a loss of capability. They are not that much capable. It is a phase of the success is gone. Column 16, success is gone. Only memory is left, remnant is left. That's why the structure is left, but it has not that much capability. There's aversion of work, any sort of work, mental work, physical work. There's also weak memory, but it is because it is column of memory. So selenium is not that much capable. That's why selenium is given for impotency. Ego. In row 3, as we go from left to right, the ego will increase. Like in sodium, there is no ego because there is only one electron in the outer shell. In silicon, there is fixed ego, silicea. Phosphorus, own choice ego. And I will do everything at my own choice. I want to listen to you. Sulfur has foolish ego. Column 17, they just want to be independent. There's a strong feeling of independence in column 17. They just want to be independent. Fluorine want to be independent from attachment because it is the row of attachment. They just want to be independent in any sort of attachment. If he is married, he want divorce from his wife. If he is in relationship, he want breakup. If he is living with his family, he want to stay in different home. If he is a kid and he want to do party or something, like if it is like a teenager behavior. If he is a college student, he want to go to the late night parties, he want to take alcohol. So that want to be independent, they want a break free life. Chlorine, cheated in love, financial matter, because it is the phase of end, abandon. Natrium mu, there is also a feeling of being betrayal in love. So chlorine, because their attachment is almost gone, they are getting away from that attachment. That's why there is sadness, despair. So that's why they think that they have been cheated in love or in financial matter. Bromium, they want to be financially, like if a lady want to do job, she want to be financially independent. It's like bromium. Iodum, it is a row of creativity. So they feel like cheated in creativity or the guidance, like no one has guided her properly. Column 18, inert gas, helium, neon, argon, krypton. So they are complete. They don't. There is no more issue. Such thing the rows they belong. It is not an issue anymore to them. Helium, they are quite happy inside. So inside himself, they are quite happy in that content life. Autism. Inert gases are quite suitable for autism because autism patient, ADHD patient, Down syndrome patient, they are quite in their own life, own shell. They used to be happy. They don't bother about that job or the identity, what people will think about them. So column 18, especially helium, neon, argon, are quite suitable for autism. Neon, from relationship. Relationship is no more issue for them, like that thought of separation or something. There is no more issue. Argon, they are free from identity. What other people will think, it doesn't bother him. They don't bother about his work. In fact, such people are quite unemployed because they don't bother about his work. Krypton, they are free from security ideas, like monks. Like normally a person wants security ideas like financial security. He want to save money, he want to do better in life to get a certain position. But in Krypton, they are like monk like feeling. They don't bother about such things anymore. Row 3, it is a row of identity. It is a toddler stage. They want nutrition, love, position, relation. They are clear about their choices, like I want to wear that red t-shirt. They want matching dresses. I want to wear red trouser in that red t-shirt. They start recognizing that what belongs to them and what doesn't. Like this is my toy, this is your toy, don't touch mine. This is a feeling of row 3. Row 3, sodium, magnesium, aluminium, silicon, phosphorus, sulfur, chlorine, argon. So it is a phase of identity. Sodium, they totally give up everything for the other person, dependent. Like when a couple is going to a wedding ceremony, the packing of the husband will be done by her wife, or the shopping will be done by her wife. Like what he will wear will be decided by her wife. So he is completely dependent on his wife for such thing. So that is totally dependent. Magnesium, lesser dependent, Filling of 4 second. There is a filling of 4 second. There is filling of often filling. Aluminium, it is a column of confusion. So there is a confusion about identity. What should I be or what not? Silicon, there is a fixed ego, fixed ideas. So they are concerned about image. They are quite clear that yes, if I'll get that mark, then I'll be popular in the class. Otherwise, I won't. So there is a fixed ego. Phosphorus, I am different. Sulfur, I am better because of the ego, that foolish ego. Chlorine, feel betrayal, hurt, so want to be free from them. So he just want to be free from all such things. Argon, they are content, not an issue anymore. Identity is not an issue for argon anymore. Sodium, dependence. Since sodium is from group 1, so they are totally dependent on other person. They are totally dependent on mother like a structure. For the choice of food, what will be suggested, he will eat. Which dress to wear, which one to purchase, everything is decided by some other person. A sodium lady used to fall in love with wrong man, married man, senior. They decide what to do because they are mature. So she wants dependence in her life, a person on whom she can depend. That's why they used to fall in wrong man to married man, senior man, because they have experience and she just need a dependence. They are emotionally dependent because of column 1. There is a failure in love because she is falling in love with wrong man, so there will be failure in love. They are introvert. Rubric, need of attention, care, love, so craves attention. Medicine is macabre. Magnesium. Affection, desires, medicine is phosphorus from the same row. Fourth row, it is about security, about task. There is strong sense of insecurity. Right and wrong is very important to him. Money is very important to him because money is a form of security. So security is very important to him. They want family, they want job, relationship, stability in their life. Fourth row, most of the element of D block is in fourth row. So they are hard in nature. That's why fourth row is hard, tough. There is a fear of theft because it is a phase of insecurity. There is a fear of theft, fear of animals, fear of robbers. There is a fear of security, fear of police. What if he will be trapped in some false allegation? That's why there is a fear of police. There is a fear of attack. Row 4, like it is a situation when there will be a intruder, a thief in the house. What will such medicine do? Potassium, do not have the capacity to protect myself because they were totally dependent. They do not have that much capacity to protect themselves. They will be dependent on someone else. They will call someone to get rid of that intruder. Calcium, secure in a normal condition, but if there is a threat, need support, backup. Like in calcium, I can live in a separate house, but when there will be a thief, I just want someone else to get rid of him. Scandium, can I do or can I depend on someone? He is not clear about it, whether he can do it or not, whether he can get rid of that thief or not. Vanadium, going ahead and coming back. He is not prepared yet because it is a column of 5. Column 5 is about prepare. So they are not prepared yet. So they will just go ahead then come back. Whether I should go, no go. Chromium, I have to take risk even though I am not prepared enough because it is the column to prove themselves. So they think that yes, I have to take risk although I am not prepared yet. I have to take risk. I have to get rid of that intruder. Cobalt, I can defend, but I doubt whether I can protect completely or not because it is of column 9. Column 9 is near perfection. They are not perfect. So the thought is also like whether he can protect completely or not. Nickel, they are column 10, perfection. So I am successful in protection. In fact, they feel like a police. It is his duty to protect himself and also to protect others. That is nickel. Cobalt, it is a column for maintenance. So there is a time to time attack spasmodic. He think that time to time he will be alert, like oh, is the thief there or not. So it is a time to time attack. There is a thought. In Jinkum, it is a column to defend. So they are defensive all the time. They are always alert. Like when there will be a intruder, I will fight him. I will fight with him. Germanium, thieves has already in house. How much I can protect? Because it is column 14. It is a phase of weakness, give up, So they think like, okay, now thieves are already in the house, what else will I do? Just take the stuffs you want and get away from my house. Arsenic want to depend, but there is no one, because there is a phase of loss, there is a sense of loss. He want to depend on someone, but there is no one. He know that it's him who will fight. Bromium totally insecure and completely alone to face the danger. He know that he have to face that danger. There is no one on whom I can depend. He also want to be independent, that's why he will fight alone. Krypton, I can protect without anyone's help, because he is content, he is satisfied, so he know that I can protect himself and he don't need any sort of help from others. Rubrics are insecurity, arsenic, calcarea iode, hypo, that is carbon, calicarb, that is potassium and carbon. Delusion, imaginations, crime committed he had, because there is a sense of insecurity, there is a delusion that he has committed a crime. What if people will know about him? What if he will go behind the bars, police will take him along with them? There is a feeling. So the medicine is calibrom, zincum oxidatum. As if I have done something wrong, there is also the guilt there. Other rubric is delusion, imagination, money, because they want money. I want to have my own money, my own house, wife, car, children, insurance. Such thing a phase of security. Insurance is also a form of security. Financial support financial as well as family. Any sort of support they need. So such things are just security. Supporting a part emulation means when they get support, they feel better. Calcarea, kashikam, that is potassium. Ferrum, hypo, that is carbon. Calicarb, potassium and carbon, so all are from that security row, so they want support. When there is a scenario of a student who is a BHMS pass out or MD pass out, what will happen to him about the clinic? Like potassium, calcium, scandium and titanium. Potassium, I am totally dependent on father for the practice. He will sit along with his father so that he can take he can do case taking, he can see patient. Calcium, I can do it, but I will send difficult cases to father or teacher or my senior. I can take the easy one, but I think that I can't solve the difficult one, so I will send them these cases to someone else. Scandium, there is a doubt on their capacity. Can I do it, or better to give the difficult cases to someone else? They can do the easy one, and about difficult they are doubtful. In calcium, they will send them to someone else. In scandium, they will think whether they can cure them or not. Titanium, I want to be a homeopath, clear decision, they will take such cases, although they are difficult, but they will take such cases. In column 9, they are near perfection, so there is anxiety. In cobalt, there is anxiety, delusion, he has done something wrong thing, he is a criminal and people know about him, because it is a row of security, so they think that what if someone will know about him that he has done something wrong. So there is a phase of insecurity because it is near perfection. Iridium, I am near success. What if I make a mistake, not succeed? Because it is a row of responsibility. He know that he will do one mistake and his all the hard work is gone. Like it is a phase of responsibility. It is a phase of middle age. It has lots and lots of responsibility for his parents, for his children, for his spouse. That's why there is a great fear. What if he will not succeed? Fifth row, silver series, it is about creativity and performance. They want to perform better. They have high performance, doing something new, so people will appreciate. They want to do different things, new things. Too much concerned about success. Appearance, silver is quite a beautiful color. They bother about their appearance. They were very concerned about their appearance. Voice, argentum metallicum is medicine for voice. They are very conscious about their voice. They used to talk politely so that people will appreciate him. Row 5, strontium. It is a row of creativity and performance. Strontium needs guidance to learn the creativity, because there is always a backup plan. They need guidance. They are not totally dependent, but at least they need guidance. Column 10, they don't want any sort of criticism. They desire good opinion. Nobody should criticize him, because it is column 10. It is column of success. They are the ruler, so they don't want any sort of criticism. Silver, maintain to be best. 10 was success, 11 is to maintain. So he will do more hard work than getting success so that he can maintain that success. He will do more hard work to maintain that position, to maintain that rank. People should appreciate his stuffs. He always want that people should appreciate his new car, his new house. Sternum, losing the structure, weakness, because it is the column of give up and accept its changes. So there is a losing the structure, there is weakness. That's why sternum has weakness. Rubric, creative, sternum, sternum, iode. Sixth row, it is gold series, which is about responsibility, about power. Power, leadership, maturity, dictatorship. They want to rule on others. They want to make laws. They want to be leaders so that they can take decision. They want to be decision maker. Such people are CEO of some company. They are revolutionary. They feel like a ruler, like platinum, gold, mercury. All of them feel like a ruler. When there is so much responsibility, also there will be so much stress. So the opposite will also happen. Sensation of heavy load, can't be dependent on anyone. I took the responsibility, so I will do such things. So I can't be dependent on anyone. Pressure of people expectation, because he had taken that responsibility. So people, there is also a expectation. The pressure of expectation, what people will are expecting lots and lots of things from him, and when he will not succeed, when he will not on that up to mark, there will be despair, there will be sadness, there will be no hope. Then they will be go to the phase of syphilitic phase. That's why gold, platina, mercury, all of them are syphilitic medicines. Row 5, need a guide. Row 6, become a guide. Row 6, it is a row about the responsibility. I can barium, I can responsibility, but when too much responsibility for me, need to depend upon someone. I can't take the whole responsibility when it is that much. That is barium. Osmium, I'll work hard against the difficulty. I'll take lots of responsibility, because osmium is in column 8, and column 8 is about want to fight. So they want to struggle. Column 9, iridium, they are near perfection. Column 9, I am near success. What if I make this mistake? What if I won't be succeed? So they want to be succeeded. That's why there is anxiety because of the responsibility. Platina, they are successful. That's why there is superiority complex, because they are of column 10, the phase of being ruler, the phase of being successful. Mercury, column 12, it is the column to defend. So there is a delusion surrounded by enemies, always have to be alert. Like if he is a employee, he think that other people will snatch his position. If he is a student, he think that other people will snatch his first rank. So they feel that they are surrounded by enemies. Plumbum, it is a phase of giving up, because it is column 14. Give up is prominent in column 14. Row 7, it is uranium series, so the feeling is letting go. The radioactive element, in row 7 they are radioactive element. Radioactive element has tendency that they used to lose their mass. Just like old age, the structure is getting weakened, structure is breaking, disintegrating. Old age, beyond leadership, they want power, but beyond leadership, they don't want to be leader, they want to help others. That's why they are universal helper. Such people are saints. There's also dream of terminal incurable disease like cancer. There's dream of death. Everything is just disintegrating, breaking things. Want meditation, like every old people. They want meditation, less attachment, more detachment. They are depressed, hopeless. Those 7. Uranium, like if there is a patient of uranium, he is suffering for cancer. There is a huge responsibility for family. He is not bothering about him, what will happen to him because he is going to die. He will get bothered about his parents, his children, his family, what will happen to them after him. So they are bothered about other people, not about them.
Dr. Vaidehi, sorry to interrupt.
Yes, sir.
Only five more minutes to go.
Yes, sir. This is the last slide.
Yeah.
Row 6, power for himself. They need power for themselves, while row 7 need power to help others. Both of them need power. 6 for themselves, 7 for others. This webinar was exclusively dependent on the concept of Dr. Rajan Sankaran. The books were Sensation in Homeopathy, Sankaran's Schema, Structure, and Secret Length Nights of J. Shelton. Thank you for your time.
Thank you, Dr. Vaidehi. And your session helped us to classify the periodic table, and you explained from hydrogen to radon, how these elements work. And I think Dr. Sholton also pointed a lot of things to expressing these elements in periodic table, and we need to give more emphasis on Shelton also, and Sholton, Jan Sholton.
Yes.
And it's great you have collected all these things from Dr. Rajan Shankaran, and it's great. So it's a wonderful session. A lot to study more on this, and I welcome the participants to interact with the speaker. We only have 3-4 minutes. If anyone is here, she explained in detail the series, and Dr. Hubert De Silva is with us. Doctor, please.
Hello, Doctor.
Yes, sir.
It was a very nice presentation and highly, deeply studied one.
Thank you, sir.
What we want to study more. I think that it is a very highly researched material for us to follow. Because whenever we study the things in other material, the plant kingdom or anything like that, there will be inside that plant kingdom, these type of studies is very much needed. Which are the materials are more in that this kingdom, vegetable kingdom. So your great effort and your learning, very nice. Thank you very much. We are congratulating you. You're here, and then you have to come to our platform. Thank you all. Thank you very much. Thank you.
Thank you, Doctor. Next is Dr. Ram Pravesh Shah.
Hello. Good evening, everyone. Dr. Vedehi, very, very thanks. Congratulations.
Thank you, sir.
Excellent session. With these elements, role of the mind and other. Very, very thanks. Thank you, Dr. Vedehi.
Thank you, sir.
Next, let me welcome Dr. Dhanesh for the vote of thanks, as it's time to conclude the session. Doctor, you can unmute yourself.
Good evening all, and good evening Dr. Vaidehi. It's really one of the best presentation as far as this periodic table concept is concerned.
Thank you,
As
sir.
we have very good idea about all this thing from Dr. Rajashankaran's methods of practice, and you have given a beautiful explanation to each and every table itself, and why the periodic table is important and how it will help a homeopathic doctor to claim to find out the medicine in the shortest possible time also. Anyway, on behalf of International Forum for Promoting Homeopathy, as well as on my behalf, thanking you for this excellent session. Thank you all.
Thank you, sir.
And it's time to conclude the English session. It's a very interesting session, very deeply studied. She presented it, and now it's time to start the Malayalam. Over to Dr. Shaila.
താങ്ക് യു ഡോക്ടർ ബിന്ദുരാജ്. എല്ലാവർക്കും നമസ്കാരം. ഇന്ന് IFPH 1100